Hello, this is Dr. Hobson. Today's vlog is going to be discussing upper back pain, dorsal kyphosis, Dowlinger's hump. As a health empowerment guide for you, I'll be discussing what causes this and how to prevent it. First, I'm going to show you the anatomy of what happens, and then I'll show you the exercises that you can do successfully at home to help start correcting this and even prevent it. In dorsal kyphosis, the upper part of the human spine starts to slowly be carried forward. And this happens because muscles start to weaken as we age. And because of chronic postural problems we have and neglecting our strength, as these muscles atrophy, our body weight starts to pull our rib cage forward. A lot of our patients have come to me and have said, how can I stop this hump in my back? And my mother and grandmother had this dorsal kyphosis, this senile hump in their back. I want to prevent that. I see mine starting to happen, so how do I fix it? So muscles that help balance this are the erector spinae muscle groups, the upper trapezius, lower trapezius, some of the latissimus dorsi, the rhomboids, all need to be strengthened in order to pull that back in a flatter position. But the upper back humping backward is also associated with the lower back swaying inward. So when we see kyphosis occurring here, we also normally see lordosis, or an inward sway of the low back. So these curves become accentuated. To fix this, we also need to work on what's called anterior core muscles for the stomach. The anterior core muscles are the rectus abdominis and the three layers of the oblique, the internal and external oblique and the transverse oblique. Today I'm going to be demonstrating in our little gym how simple exercises you can do to strengthen the core here, which will help flatten the lower back, strengthen the muscles of the upper back, which will help straighten your upper back, thereby preventing most of these problems. One last point I would like to make is as we age, if we don't do these exercises, our bones will start to continually weaken and first cause osteopenia, and then it will cause osteoporosis. So the type of postural analysis we'll be doing is the most common. It's a physiological postural development versus pathological, which is fractures in the spine and various birth defects. But the most common by far is a physiological change that happens to us as we age. So in this first exercise, we're going to be doing movements that strengthen the upper back. And one of the most efficient ways to do that, there's many ways to do this, but one of the more efficient ways to do that is simply by getting some rubber bands that are designed for working out with little handles on them. They come in different weight sizes, from 5-pounders up to 50-pounders. Hook them around something stable, like a bedpost or some kind of frame, and then sitting on the ground, you begin this rowing exercise. And there's 3 vectors of rowing I'm going to show you that will strengthen the lower back, the middle back, and the upper back. The first one is just the middle back rows, and you simply pull back, squeezing your shoulder blades together. And you repeat this about 5 to 10 times, and you do 2 or 3 sets of these. And so as I pull back, I squeeze together, and I can turn my hands sideways, and I can turn my arms, hands up. And this works mostly through the middle portion of your upper back. The next one I'm going to show you is a vector pulling down, where you pull down like this. And this works the lower back, a little bit of the latissimus dorsi and the lower back. Again, you do 10 to 15 reps, 2 or 3 sets. The last one I want to show you, which is a different vector, so this is a pulling down vector. This is a straight back vector. The last one is a pulling upward vector, like this. It works slightly different muscles in your upper back. And again, you do 10 or 15 repetitions and do 3 sets of these. This particular exercise only needs to be done about 2 or 3 days a week. So that works all these muscles of the upper back. As they get stronger, they'll naturally start to thicken up and produce a greater tonus and pulling force in the upper back. And it will begin to lift and pull your shoulders backward naturally. Without you even having to think about it, those muscles, as they increase in tone and strength, will begin to pull the upper dorsal back. Now we need also a counterbalance, because this problem up here is usually also associated with a hyperlordosis in the lower back or sway back. So we want to straighten that out by tightening our anterior core muscles. And when we tighten our anterior core muscles, it pulls the pelvis forward and flattens the lower back. Flattening the lower back also helps the upper back to then go straighter. So here's the exercises I recommend for strengthening the stomach. Just get an exercise ball. While sitting on the ball, you roll back and lock your feet in under a bed or under a bench so you don't fall backward. And as you roll backward, you pull your legs and then roll forward. Now I recommend doing a rolling exercise where you kind of roll like this, and you do 10 or 15 of these, one direction, clockwise or counterclockwise, and then 10 or 15 of these counterclockwise, or the opposite direction. As you're doing this, you're strengthening lateral core, you're also strengthening lower and upper rectus abdominis. If you do these exercises, this particular one, 2 or 3 times a week, your anterior core will begin to strengthen. Your lower back will start to naturally lose its lordosis. The upper back will naturally start to strengthen, and you can keep your muscles strong. You can also keep your bones strong, which means preventing osteoporosis. As this happens, your upper back pains fade away. An important note when doing any weight resistance exercising is to find the weight and resistance that's comfortable for you. We mentioned doing 10 or 15 reps, 2 or 3 sets, but some patients will be able to only use 4 or 5 pounds, just a little more than the weight of your body, while others will be able to use 20 or 30 pounds. So you need to find the resistance that's good for you and start out slow and slowly progress up over weeks and months. And we want you to do these exercises without hurting yourself. So if you like what you see on our blogs, please follow, post, and share. And until next time, this is Dr. Hobson, wishing you good health and being able to take control of your lives and feel stronger and healthier. Thank you.